Hello, this is Anna, and my behaviorist bio is on Dr. Lee Kern. Dr. Kern is currently a professor and director of the Center for Promoting Research to Practice in the Special Education Program at Lehigh University. She holds a master's and a PhD in special education and is also currently a co-editor for the Journal of Positive Behavior Intervention, and she has been co-editor for that journal from 2013 to the present. Her area of focus for the past 25 years engaged students with emotional and behavior disorders and students with ADHD or attention deficit hyperactivity disorder. She worked as a classroom teacher, behavior specialist, researcher, and editor, all from '98 to the present. This is one of her quotes from when she got promoted to director of the research center. She says, "The center will continue to engage in efforts to assure this extraordinary work reaches many more children, adolescents, families, and teachers. In addition, we will work to help address service gaps in the Lehigh Valley and beyond." So the first journal that I examined was the Social Story Interventions for Students with Autism Spectrum, a meta-analysis. So this article focused on inappropriate behavior in children with autism and how social stories can be implemented to help them in responding to social situations with the appropriate behavior. So these social stories explain difficult social situations and concepts in simple words, which makes it easy for these students to practice it. There are several components of these social stories. They are descriptive, perspective, directive, cooperative, and affirmative. Now, descriptive describes the situation and the people involved. Perspective describes the feelings and responses of the people involved. Directive is pretty much what the appropriate response is supposed to be. Cooperative is how others will cooperate to assist in the appropriate behavior or response. And the affirmative gives meaning to the whole situation and expresses the values of these lessons in a given culture. So the conclusion from this research study is that the effectiveness lies in the reductions in inappropriate behavior. Sorry for the typo. But not so much in the building of social skills. So further studies are needed before we can say whether or not this is a beneficial and effective method to reduce unwanted behavior. Another article I came across and examined was the Early Intervention for Young Children with Attention Deficit Hyperactivity Disorder, Prediction of Academic and Behavioral Outcomes. Now, this article focused on the prediction of academic and behavioral outcomes based on the following factors: child's characteristics, family characteristics, and type of treatment they receive. The degree of stress that a family experiences, as well as the dosage of medication, number of treatment sessions, and intensity of therapy are all suspected to be predictors of reading and math achievement and oppositional behavior. According to the study, the best predictor for academic achievement was the childhood characteristic, which is the age, the gender, the race of the student. And that was the best predictor for the academic achievement. However, there were limited results for the disruptive behavior predictors. Okay. So addressing the needs of students with social, emotional, and behavioral problems. So this article focused on implementing more promising practices to add to the progress of these students. So there are several issues when it comes to addressing these students' needs. And her goal was to educate and suggest several techniques that we can use to improve our handling of these situations and to improve the progress of these students. So the issues that she touched on involving the teachers not properly trained. Now, she stressed the importance of properly training teachers and educators to address these situations from aggressive behavior, whether it's verbal or physical. They should be properly trained to handle these situations so they can decrease and eventually prevent these behaviors from happening. She also touched on the negative labeling of emotional issues. She used the word emotional disturbance and how that has a stigma attached to it, and we have to let go of these negative labels and see beyond that and try to reach out and come up with better techniques so they can succeed better in school. She mentioned the overuse of punishment and lack of significance in building rapport. Those were also issues she touched on. Building rapport is an important one. Adult and student relationships have positive outcomes, and they involve higher academic achievement, fewer behavioral problems, reduced rates of school dropouts, and healthier relationship with peers. So the main points of her work, her main goal was to examine and suggest better strategies and techniques to improve the education experience for both students and teachers. So she mentioned something called school-wide positive behavior supports, where she talks about how punishment has been proven to not improve behavior, to not improve behavioral issues. So this movement uses positive support and encouragement tailored to each student's specific needs. And these are my interview questions. If I had a chance to interview her, I would ask her the following questions. First, I would like to know what sparked her interest in human behavior, more specifically children with behavioral and emotional disorders. I would like to know what advice she would give to a parent if their child has been newly diagnosed with a behavioral disorder. And based on her research and personal experience, I would ask her what the most effective type of therapy is to manage inappropriate behavior and increase desired behavior. So I too have an interest in focusing my work on children with emotional, behavioral, and mental issues from a personal point of view. Is there any advice that she would be able to give me on how to approach more difficult situations like physical aggression? I know she did some research on preschool children with ADHD. I wanted to know if she can clear some of the myths up about ADHD, such as statements like, my kid is so hyper, he probably has ADHD. And if it's classified as a learning disability or a medical one. So the significance of her work, I think it is really important in the education field to make sure that all of the students are provided with the tools and interventions they need in order to succeed. Students with emotional behavioral disorders are known to have a much harder time in school because teachers are not always adequately trained, and there is still a stigma associated with emotional and mental issues that needs to be eradicated. So even though these behaviors can provide many challenges, these students are just as deserving of success and achievement in all aspects of their education and their personal life. Thank you.